All right, welcome to another Zoom call. We got some questions to go over, and then we'll open it up for questions. Again, remember to submit your questions on the membership site. If you're having trouble getting on the membership site, or you don't even know there is a membership site, um, uh, email me at info at connorsclinic.com, and I can get you another invite to the membership site. All right, let's get started. Another reminder to look to answer, see if your questions have already been answered. Go to the website, a regular website, and you can do a search. And you can type in that search panel what you're looking for. Maybe I did a video on something. Maybe I did a blog post on what you're looking for. I don't know. Also, we're getting less questions, so I think the membership site is also helping. So we only have a few questions to go over. Let's get started. With regard to castor oil packs, understand this isn't our castor oil pack description here. I just pulled it off the internet. How much value is there to just applying castor oil to the skin over the liver without using topical packs? Well, heat will help drive the castor oil, help you absorb the castor oil better than if you just put castor oil over your skin. So heat is something that can open up your pores and help drive the castor oil. That's the idea of the castor oil pack. One of the things that people have struggled with the castor oil packs is that it's messy and that it takes time out of your day. And goodness sakes, I don't have time to do another thing like that. Well, I recommend just using a hot water bottle or one of those infrared heating pads. Those are my favorite. To put that just over your liver without the castor oil, if that helps, just to have a hot pack near you, that infrared heating pad, have it already plugged in to where you lie down or sit down or where you're going to sit and watch TV or read a book, and you can put that over your liver. That can help. So just heat can help. Castor oil and heat is maybe a step better. Just another thing to help with your detox pathways. I had a tumor in my colon. It has now been removed. There were signs of cancer in the lymph nodes. The CA-125 is the blood test that would be recommended for me. Or is the CA-125 the blood test that recommended for me? Is that what I had done? That is what I had done at the hospital before and after the surgery. So I did a screenshot of a blog post that I wrote about tumor markers. So you can find it by going to the blog, going to our website, and looking here, just search tumor markers. So I just did a screenshot of my tumor marker blog post, and number 5 is the CA-125, cancer antigen 125. It's useful for monitoring ovarian cancer, liver cancer, colon cancers, etc. But also the CEA is another tumor marker for colon cancer. That's another helpful one for colon cancer to look for as well. So think about getting that one done. So if your CA-125 was normal prior to the surgery and normal within normal ranges after the surgery, it might not be the most valuable test to run as a monitoring tool because it's within normal ranges. So with colon cancer, it's really the CA-125 or the CEA. Those are really your only two options for tumor markers. So I would request those. Now that I've had the Cyrex 10 results, this is a person who did a Cyrex 10. So a Cyrex 10 is a food sensitivity test. So that's what that is. So it's a food sensitivity test. Oh brother, sensitivity test to measure antibodies in your blood for different foods. Test 300 different foods. In this person, she had no food sensitivities except cooked scallops. Well, that's easy enough to eliminate those out of your diet. Do I still need to take HistaClear or histamine scavenger and do a low histamine diet? So If you have food sensitivities, you are going to have a lot of inflammation in your gut from that food sensitivity. But you can have inflammation in your gut for other reasons. So let me finish this question so it'll help you understand this. What is the likely cause of the inflammation in my body that causes the granulomas? I just read that the CA125 isn't a marker for ovarian cancer as much as it's a marker for inflammation. Is that true? Then what should I be doing to lower the inflammation besides the protocol you've given me? So this is a person, like so many people with cancer, that have inflammation. So when you have inflammation, you do want to do your best to find the sources of inflammation and to reduce those sources of inflammation. It's not always possible to do that for every avenue of inflammation you have going on, but you want to reduce the sources of inflammation. Because this person had a lot of inflammation in their body, I suggested that we run a food sensitivity panel. And the best one on the market now is the Cyrex 10. Cyrex is the name of the lab. They have a bunch of different tests. The Array 10 is their food sensitivity panel. Why would I recommend that? Well, because if you had a lot of inflammation in your body, and if it was one of the causes of it was the foods that you're eating, even though it might not be a driver of your cancer and really have very little to do directly with your cancer or cancer growth, it can have a very direct correlation to the amount of inflammation you have. So foods can cause inflammation. And how that happens is that if you have a leaky gut, meaning a separation of your cells in that line your intestinal cavity, the epithelial cells, then larger proteins, larger peptides get across the gut membrane and larger than it's supposed to happen. And then you end up creating antibodies against that peptide. So now when you eat that food and your body breaks that protein down into smaller particles called peptides, every time you eat it, you fire an immune reaction and you create this inflammation in the gut, which further damages the gut lining, which further causes leaky gut, which is this cascading negative cycle. So in order to break that cycle, you want to get rid of, eliminate those foods that you already have circulating antibodies against their peptides so that you cut off that inflammatory cycle. Now, that being said, we were just taking a shot in the dark. We didn't know this person didn't have any gut symptoms, but they had inflammation. So if you do have inflammation, let's start looking for sources. So we did the Cyrex 10 to see, was it foods? Well, the answer for her was a resounding no, it really wasn't foods at all. So that still doesn't mean you don't still do things to calm down the inflammation. So no, you would still take the Histoclear, you'd still take the histamine scavenger, you'd still be on a low histamine diet. Because foods that contain histamines themselves, though they might not be causing inflammation in the gut, and they could too, you still might not have any other foods. They wouldn't show up on a Cyrex 10. You'll still absorb that histamine. That's what's causing inflammation in the tissue. So no, this doesn't change your protocol whatsoever. Are there other ways to find other inflammatory causes elsewhere in the body? Yes, there's other tests we could do. There's a ton of different functional medicine tests. It really depends on how deep you want to dig. It may not change. The problem is that, oh, we could spend thousands and thousands of dollars on functional medicine tests, and it really doesn't change the way we do any of the treatment. So if a person has deep pockets, we might want to run a mold profile, mycotoxin profile. We might want to run a Cyrex 7 to antibodies to other tissue, antibodies to neural tissue. And we could keep digging in this, and I am not against that. It's just, it does get costly. Does it change our protocol? Well, maybe if mycotoxins came back, maybe we'd look at possible sources of that in your house and do some more investigation. Maybe we would do, change your Rife program where we'd be running mycotoxins on your Rife program. So yes, digging deeper can be very valuable, but partly it has, and so where do you stop, I guess is the question. And I guess the answer is, well, are you improving? Are you getting better or are you getting worse? And if the person is not improving, not getting better, and or they're getting worse, then I would say if finances allows that we do keep digging and we do some of these other functional medicine tests. So we have availability to do all of them. It's just a matter of picking and choosing what's the best course of action. So in one sense, it was great that your Cyrex came back normal, the food sensitivity RA10 came back clean. That's fantastic. But in another sense, it's, shoot, that's not what our cause is. We might have to dig a little deeper. Hopefully that helps explain that. Do you know any good mold restoration companies in Minnesota? One that will travel to central Minnesota. I heard that 90% of them are no good. We just did an ERMI test and found that we have high levels of mold and need to get it out of our home. Yeah, mold is a big culprit for a lot of problems and certainly can be just the cause to get back to of inflammation. It might not be the cause of the cancer, may or may not be, but it's certainly a cause of constant inflammation, which makes it difficult for your immune system to be able to deal with cancer or any serious disease. So getting some mold testing in your house can be valuable, but then how do you figure out where the mold is? Now, a picture that I pulled off the internet here, it's really easy to see where the black mold is, but many times it's behind the wall, and you have a slow drip of copper fitting behind your bathroom wall, and you don't ever have any water leaking out to know where it's at, but all the 2x4s and all the inside of the sheetrock is all black mold behind your bedroom that you're sleeping in, and you just don't know. What are you supposed to do? Just start tearing sheetrock out of your house? Very difficult. So taking care of mold in your home, finding a good contractor can be difficult as well. Personally, I don't know of anybody in Minnesota or anywhere that is going to be able to do that. You're going to have to find a contractor that you trust. And yeah, I just don't have a good source for you. I'm sorry about that. We used to have a company that would come in and do some testing, and you certainly could get the plates to test for mold in your house. That's really inexpensive, but to have a contractor do the work and actually find the source and do the cleaning of the mold and replace things, then it gets more difficult. One thing you can try doing is what we've recommended in multiple other Zoom calls is using one of those little air purifiers. Let me pull it up and I'll show you a picture of it. I have one in my office here at where I am. And we have one at our house. We actually have one of these in multiple staff people's office because it actually acts as a nice white noise helper as well. It looks like this. This is the little unit right here. It was very inexpensive. It's not very big. I ended up getting my daughter one. I really like this little unit. I just pulled it off of Amazon. That's where I got it. It's 150 bucks on Amazon. It uses ozone and ionization. It's got 2 UV lights. It's really the ozone that's going to be a killer of mold. So remember in our discussion of ozone, what ozone is O3. O2 is oxygen that you would breathe. O3 is an extra oxygen on an O2 molecule. It's very unstable. So ozone being unstable is used to our advantage. Typically, it's given to organisms, living organisms, and that extra oxygen can oxygenate that and kill that organism. So it's very good for killing mold. So having one of these in your bedroom at least, and you want to put it high on a shelf because O3 is heavier than O2. So as the fan blows it out, then you will, it goes out into the space. Now this little unit is not going to be enough to cause too much ozone. You'll have a smell of ozone, just a gentle smell of ozone. Too much ozone breathing in can be damaging to your lungs. This would never have that enough to damage your lungs. This, but it also will not be enough to treat your whole home either. So you probably want one of these in every larger space of your house. But they're cheap enough to get a few of them for sure. We've had people, there's also some larger ones. We actually have two larger ones before this one came out on the market that were a little bit expensive but put out a lot more ozone, that are meant for a whole house or a whole floor unit. We have two of those in our office as well. And they're nice, they're great units too. But you could actually use those too to put down the basement. We've had patients use them down the basement where they know that, or at least they think the source of the mold is. And if you get those mold plates, then you can test where the greatest amounts and mark with a marker on the bottom of the plate where you place the plate, where the greatest amount of mold spores are. So that give you an idea where you want to concentrate your treatment. This, of course, is not the solution if you got mold growing on your studs, the inside the wall. It's not a solution for really bad mold problems, but it's worth trying this and then running that test again, do another plate test and see, if it improves the situation. So something to look at. Okay, that's all the questions that came in from you guys. So anything else you might have a question about? Okay, I wear an EMF blocking pendant. Should I remove this when I use the Rife? Nope, nope, you should keep using that. It's not going to affect the Rife frequencies at all. We recently did mold remediation on our home. One place to start is your AC system, including ductwork, to make sure it is clean. Good, good. Thank you. Great comment. I've received new program flash drive for my Rife protocols and footbath. Can you tell me more about the updates? Sure, we talked about that the last couple of Zoom calls. Please, if you did receive an updated program from me, run that updated program. I've just made some improvements. I don't have everybody's done, so not everybody has received one of those yet. And they are only for people who have the F122. So it's gonna cause your bulb to be a little less bright. And it will cause your machine to run a little less hot. So your machine will run a little cooler, the bulb will be a little cooler, You have much less chance of blowing fuses or the little thing on the back of the machine, but it is actually a more powerful program. So they're excited about that. So please run your new programs. Okay, I have some questions I did not get into you in time. Please address whatever is prudent here. Are there any therapies that should not be done at the same time? That's a really great question. Can you do the hyperthermia and the PEMF at the same time? Theoretically, yes. It's just a matter of situating the units. So there should not be any issue with that. PEMF and Rife, yes, of course, you can do that. PEMF in the foot bath. God, jeepers. I don't know. I would say, I theoretically, I'm sure there's no problem, but you're using an electrical device while you're at your feet in water. I don't know. Maybe if it was me, I'd say no on that. I know the company would say it's fine, but I would probably say no on that. I recently asked a question about parasite identification and have continued to pass what appears to be mucoid plaques. Perhaps better would be to ask, what does it matter whether it is ID clarity as parasite or mucus, um, or is it just good either way? That's coming out. It is good either way. There is a parasite called a rope worm. You might want to search for that on Google. Rope, ROPE. It was discovered by a University of Minnesota professor, but he's also been poo-pooed, and some parasitologists say there's no such thing as rope worm because it looks like it looks like this long stringy mucus. Um, we've had people pass those. I think it truly does exist. We've had people pass those, um, for a period of time, and then it stopped. So I don't. So look up that too. It doesn't particularly make a difference what the identification of that parasite is, but it's kind of fun to know. I like to know. So I'm with you. I think to identify it would be good. Oh, good. You did look it up. It matches the ID. Yeah, I think they do exist because I just do. I just see them. I have people bring them in, jar. So have you had anybody use the black salve and anyone in the medical field assist the use of black salve for a client you could refer me to? We've had a dozen people do the black salve for melanoma, or squamous cell, the skin, at least that. My wife did the black salve on melanoma, 2 spots of melanoma, and I'm convinced she wouldn't be here if she had not done it. That was 9 years ago. And we have, I don't know, 8 to 10 women currently using the black salve on their breast cancer. So you can't really use black salve until the cancer has come to the surface. So you can't use, let's say you have a deep breast tumor, you can't put black salve on there and think it's going to draw the tumor out. It really won't draw more than, you know, uh, tenths of a millimeter deep, just a few layers of skin over the top. If you have an open wound, you can certainly use black salve on the tumor, and it has pros and cons. So we do assist with that. And I know that you could probably get a local naturopath or something to help you with that too. So I actually have putting together a Black Sam manual, a little booklet to help people with that too. Also, concerning mold, buy a humidistat to control the level of humidity in your house. That can be very good. Mold, obviously, mold really comes from has to be water, a source of water, and a source of organic material. So the sheetrock, the side is made of paper. So that's an organic material that mold likes to grow on. Of course, wood it likes to grow on. So that's the two things that you're looking for. And how do you feel about whole body cryotherapy as an anti-cancer treatment or cancer therapy? Well, I know cryotherapy can be beneficial to use for different cancers. Whole body cryotherapy is just, I wouldn't say it's a cancer therapy, but it's an anti-inflammatory therapy. So going in cryotherapy tanks can be very beneficial to calm down inflammation. But the truth is every person is a little bit different. So let's say you have some inflammation at your knee and you put some ice on it, it really, really helps. So that's what really helps decrease the inflammation. That's the normal protocol for inflammation. It's called RICE, rest, ice. I forgot the rest of the acronym. But that's for physical therapy, for chiropractic. You rest an area that's injured, you ice an area that's injured, so that the ice will decrease inflammation. But the truth is, some people putting ice on an area actually causes muscle contraction and irritation and more inflammation. So everybody's a little bit different. Some people get in a cryotherapy tank and they just feel so much better afterwards. You're only in there like a minute or something like that. You feel so much better afterwards. Some people, it makes them feel worse. So you just got to try that. There's certainly not any negatives to trying cryotherapy. So cryotherapy is cold therapy. I had an appointment with my surgeon yesterday, asked if she had ever heard of a tumor becoming walled off since you had mentioned that. Of course, she had never heard of that. How would you explain that to a conventional doctor? Well, how would you explain anything to a conventional doctor? They've never heard of a tumor becoming walled off because they remove them or they do chemotherapy or radiation. I mean, they just are hammering these things with nuclear bombs, so they're not going to see that often. I don't know why a person would not say they haven't seen that. I mean, goodness sakes, I shared with you my comment of a person with lung cancer with these tumors that hadn't grown at all for 2 years, and the surgeon kept nagging this person that we need to go in there and take those out of, or she's going to die. She finally complied, and they went in there for surgery, and the surgeon said, oh my gosh, they broke apart like puffballs. And the surgery took him like 3 times longer because he had to clean out all this debris because there's all dead tissue. To say that they've never seen something like that, I have no idea. Oh, thank you for the rest of the acronym, compress and elevate. Is there a low number for sodium levels that would require IV electrolytes? Or is it symptoms that determine it? Mine dropped to 121 from 127 last week. I think it's a side effect of the immunotherapy. It certainly might be. You could Google side effects of Keytruda or whatever immunotherapy using and see. I'm not sure off the top of my head. But certainly, yes, you could go in and get an IV. That would be the fastest way to raise those levels. Eat some pig salt, putting some pig salt on your food, using pig salt You can add some pink salt to water and drink it. That's a good way to get sodium levels up. But the fastest way is through an IV. Could black salve draw cancer from a lymph node through the lymph passages out through my current wound opening? Well, I know this person asking the question, and for this person, I would say yes, it certainly possibly could. If it's surrounded by anything is possible. Once you have that opening to tissue, it seems to draw. So we've had people use black salve and it continues to draw the cancer from who knows where, and they have to use it, dozen times where it's continuing to draw and produce an eschar and fall off. So yes, it certainly can. Prior to chemotherapy, my breast tumors were moving up to the surface of the skin and shrinking. Since completing 6 chemotherapy treatments, the tumors have continued to shrink 40 to 60%, but have moved away from the skin. Also, I'm sure part of the shrinking too. So yeah, it could appear to be moving away from the skin, but it's actually just because the tumor is shrinking. I think that's what you're saying. Is there anything to do that will help move the tumors back towards my skin? Or is that an immune response that might happen as decrease in starting chemo? Yeah, that's a good question. I don't know. There isn't anything that's necessarily going to draw them more towards the skin. Maybe when you're done with chemo and we might see that change. Depends on if you're going to end up doing a lumpectomy after chemo. But I have not received a new program. I will see where we're at in your works. If that has been completed yet. Help me understand, what does it mean that the tumor has been walled off? Does a wall of healthy tissue literally grow around the tumor, preventing further tumor growth? Yes, it can. So how your body can wall off a tumor is it just literally, you end up with fibrous tissue around the tumor. So you still have this tumor there that now, over the course of time, the tumor hasn't grown for, months or years. So if the tumor hasn't grown or for months or years, it's really not acting like cancer anymore. So cancer is defined by cells that are in rapid replication. And if they're in rapid replication, they are going to be the tumor itself is going to be getting larger with hard tumor. So your body has just stopped growing, and you can end up just getting a protective layer of fibrous tissue around it. As I continue with chemo, my body is increasingly hypersensitive. I am already on a low histamine diet, but I am seemingly increasingly histamine sensitive. Would it make sense to add histamine blocker supplement or something? It's quite possible. So the histamine blocker supplements that are out there is we have a product called HistaClear, which is the DAO enzyme. That helps break down histamine in your gut, whether it's made in the gut because of a hypersensitivity reaction to a food or something like that, or anything that's causing histamine production in the gut, or you're consuming histamines in your diet. That's what that will do. The DAO enzyme doesn't absorb and get into the system very well, so it mainly stays in the gut. So the purpose of the DAO enzyme is to break down histamines in the gut, in the lumen of the gut. That's called HistaClear. We also have a couple other of histamine products that have different nutrients in it that are known to help decrease histamines in the tissue. So one is called Histamine Scavenger, one is Natural Clear Hist. They're two different products. One might work really well for one person and not for another. So you got to experiment with those. And then we also have different things that will just decrease inflammation. So other things that will just decrease inflammation, you're probably on like the flavonoids like curcumin and resveratrol and green tea extract and things like that. So you have to experiment and see if that will help. Unfortunately, chemo does damage a lot of healthy cells and could cause issues. I've listened to a talk about the pH miracle treating cancer by Dr. Young, recommending drinking sodium bicarbonate water, says 2 to 3 teaspoons to a liter of water and testing your urine pH. What do you think of that? P.S. I've noticed my pH is 8.0 urine after sleeping with my Rife frequencies consistently. So, anybody that's been with me for very long knows my philosophy of this book, and it just doesn't jive. That's just my opinion. So from a physiological standpoint, it just does not make any sense physiologically, just understanding physiology 101. If you're going to drink sodium bicarbonate, which is very alkaline on the pH scale, high pH, all you're going to really be doing is alkalizing your stomach, because you're going to your body's going to break down sodium bicarbonate into sodium and carbonate, and you won't absorb it as sodium bicarbonate. So all you're going to be doing is, it can be a source of sodium, but your body's going to break that down. You're not alkalizing the rest of your body by doing that. Matter of fact, by alkalizing your stomach, you can be actually causing other health problems, because you won't digest your food very well, because you need the HCl in your stomach to break down your proteins and your carbohydrates in your stomach. So you then will send food boluses to your small intestine, only partially digested, and put more stress on your small intestine and your gut. So I am not a fan of this. I'm not a fan of testing your urine pH. Your urine pH does not equate to your cellular pH and your tissue pH, nor does your salivary pH correlate to your tissue pH. All it does is correlate to your urine pH. And you can get an increased urine pH, a more alkaline urine, by just eating a better diet, because you're getting more minerals, and you'll spill more minerals into your urine, which will raise your pH. So when a person changes their diet and eats a better diet and is eating more plant-based foods, and they're getting more plant-based minerals. So remember, you need plant-based minerals for your body. You'll get enough, and you'll dump what you don't need, and you will raise your pH. So that's the best way to do it. Drinking sodium bicarbonate, I don't know, sorry. It just does not make any sense physiologically, and I don't mean to bash someone who has a theory, but physiologically, it just doesn't, I just can't understand it. So maybe if somebody smarter than me would explain it to me, it would be helpful. Any other questions? Do the prebiotics and probiotics in Sun Spectrum that you have provided create or provide butyrate to treat leaky gut? I have read that butyrate is a great way for correcting leaky gut. Yes, I would totally agree with that. Butyrate is a great way of helping fix leaky gut. Now, your body makes butyrate from prebiotics. That's why you would take prebiotics. And you have prebiotics, would be fiber is a prebiotic. And so a prebiotic is a indigestible, a non-digestible fiber that you break down and you make butyrate out of, or butyric acid. Now you can take butyrate directly. We have that product as well. So somebody with a really bad leaky gut can take butyrate. We have a product from Designs for Health called Tributyrin or something like that. That's a great source of butyrate in the 3 forms. So it can help with leaky gut. But Sun Spectrum can do that same thing. So unless you have a really, really bad leaky gut, then there's some other things you want to deal with. So good question. Okay, if there's any other questions, I will we'll close this out. Hopefully it will record and save and I can upload it. Say a prayer, please. And we'll have it up on the site. Thank you guys, and we'll see everybody next week. Bye-bye.